not all curves are created equal. Some bend, some don't. And this is important because spinal flexibility is one of the most important factors in determining the likelihood of reducing the size of the curve with both non-surgical but also with surgical interventions. Hi, I'm Dr. Chris Gubbels, leading authority in the non-surgical treatment of scoliosis and the head scoliosis clinician at ScoliCare Denver. See, scoliosis is a three-dimensional spine deformity. And the more deformity there is in the spine, the stiffer the spine gets. And the stiffer the spine gets, the harder it is to effectively treat or to reduce the size of the curve. And it's one of the questions I get asked all the time. Parents, generally, the number one goal is to prevent the likelihood of a curve progressing to surgery. But beyond just preventing surgery, most people also want to know, what are the chances we can actually reduce the size of the curve? And my answer is usually, that depends. And one of the biggest things that depends on is how flexible or mobile the spine is. So there's some exact things we can actually use to detect that. Now, one of my frustrations is with the inappropriate or inaccurate advice, and I see this online all the time by people that are marketing some type of scoliosis treatment. A lot of times it's ineffective or inappropriate treatments, or by providers that are just not really skilled or knowledgeable in effectively treating scoliosis. I'll give you an example. There's one group I see patients all the time where they're recommending this off the shelf or a soft brace that you can just order online by sending in your x-rays. And we know that soft bracing sometimes can be helpful for smaller, more flexible curves, but a lot of times the same brace that we know only really works in small, more flexible curves is being prescribed to people that have larger curves or stiffer curves. And in those cases, a brace like that has no chance to effectively treat those curves. So those curves that are larger and stiffer need more aggressive treatments. They typically are going to need some kind of rehabilitative method in addition to bracing, and a bracing is going to have to be more rigid. Also, if we have a stiff curve in someone that's younger and we think we can still reduce the size of it, we may make that brace differently. And let's say we have an older adult that also has a stiff curve, but we know we're not even really attempting to try to reduce the size of the curve. So you have to understand how the size and flexibility of the curve directly impacts the best and most appropriate treatment, and also how we approach an individual case when it comes to treating scoliosis. So how do we go about determining the actual flexibility of their spine? Well, there's two main methods that we actually use at ScoliCare Denver. One of those is using lateral bending x-rays. And this is the same method that, orthopedic surgeons use to determine the likelihood of them reducing the curve during surgery. So let me show you what I'm talking about. This right here is a patient, and over here on the left side here, this is their normal standard x-ray. They have a 38-degree curve. The patient is standing. There's a 38-degree right thoracic scoliosis. This one over here is the patient bending into the curve, and it goes from 38 to 46. And this one over here on the far right is the patient bending away. Now, typically, if you bent this way, you would actually have a reversal of this curve. But this curve reduced from 38 degrees down to 18. So we know that curve is stiff, It's not like the worst case, but we know it's stiff, and we know we have to do some things to increase the flexibility of the spine to effectively reduce the size of the curve. So in a case like this, we're gonna do very specific things in the beginning of the treatment to increase mobility, and we know we have to consider the flexibility of the spine when we're actually making a brace for this specific curve. Now, the other thing we look at is something called the angle of trunk rotation. So we measure the angle of trunk rotation using what's known as the forward Adams bending test with the Scoliometer. And this device right here actually measures how much rotation someone has. So this is typically done when someone is standing, they put their heads together and they bend over. If you're an older adult, you probably had that done when you were in school. They maybe just didn't use the Scoliometer. So we can measure this when someone is standing and bending over, and then we can also measure this when someone lays down, and we can see how much that reduces, and that gives us a predictor of how flexible the spine is. We also look at this when we're doing our 3D scanning to make a brace. Here you can see the rib humping with the person standing and bent over. You can see how prominent that is. And then this is the person laying down, and you can see how that reduces. So that gives us an idea of how mobile the spine is. So the flexibility and mobility of the spine is one of the things we have to know, and it's one of the things that we are going to look at when we're determining what kind of treatments we're going to do and how we're going to approach individual treatments. So let's say we have a patient that has a rigid spine and they're going to get a brace. we know that we're going to probably do more intensive, more aggressive scoliosis-specific rehab in the beginning. We're probably going to do some very specific things that are geared to really working on increasing mobility. And we may do some traction in the office and at home using something called the Scoli that's specifically designed to increase mobility in the spine. We are basically preparing someone for the brace. Now, if someone has a very hypermobile, a very flexible spine, we know we're probably going to work on strengthening and stabilizing as the primary focus right away versus increasing more mobility. Now, something about increasing mobility. There are some treatments out there that focus really heavily on heavy aggressive tractions and increasing mobility. And that is okay if you also have a way to stabilize the spine, such as doing a custom brace. But if you increase mobility of the spine and you don't also stabilize the spine, in the short term, the curve may be better, but you've just made it extra hypermobile, and that can actually accelerate curve progression over time. So we have to increase mobility, but we also have to have a plan to increase strength and stability on top of mobility. And the other thing we look at is hypermobile spines have a higher risk of progression. And I believe this is why we see more scoliosis in certain populations. For example, we know when we're looking at adolescents, people that are involved in competitive things like gymnastics, dance, or swimming, they typically have more mobility or they're more hypermobile compared to people not involved in those. And people that are hypermobile have an increased likelihood of developing scoliosis. Actually, dancers and gymnasts and swimmers are 10 times more likely to develop scoliosis as an adolescent compared to someone that's not involved in those activities. Also, there's even certain connective tissue disorders that are related to hypermobility that increase the likelihood of developing scoliosis, specifically Marfan's disease or Ehlers-Danlos disease. So if you're watching this and you know you have scoliosis or your child has scoliosis and you're trying to determine the best treatments for you or your child, click on the link below and request a free discovery call, and we can review your individual case. We can let you know your likelihood of the curve progressing, and we can let you know what treatments you may be a candidate for. Now, another important factor in determining the most appropriate treatments is how much growth is remaining. So click on the next video and we'll deep dive into how growth impacts scoliosis treatment decision making.